loss is just part of getting older, isn't it? Well, that's the myth. And we've been taught that bone loss is a normal part of aging, especially in the jaw. Receding gums, loose teeth, implant failures. But what if that wasn't about time? What if it was about insulin? Because just like we store fat, we also lose bone. When our hormones go haywire and the jawbone, it's often the first thing to show it. So, welcome everyone. My name is Dr. Mark Shankman. I'm an oral and maxillofacial surgeon that believes in treating the whole person, not just the mouth. And today on the Obesity Project, episode 73, how low carb diets reverse bone loss starting in your jaw. So, let's get something straight. Insulin is not just a blood sugar hormone, it's a bone hormone. Insulin affects osteoblast activity, which is the cells that build bone, osteoclast regulation, the cells that break bone down, and vitamin D metabolism, along with calcium absorption. So there was a 2016 study in Bone Research showing that hyperinsulinemia or elevated insulin levels inhibit osteoblast differentiation, the cells that create bone, while accelerating osteoclast activity, leading to net bone loss. So the amount of bone being created by the osteoblasts is less than the amount being destroyed by the osteoclasts. So let's talk about a real world example. In patients with type 2 diabetes, we often see increased alveolar bone loss, even if their oral hygiene is fine. And that's because it's not a plaque issue, it's a hormonal terrain issue. So the first thing that happens is insulin resistance disrupts bone metabolism. Well, the second thing that happens is we get chronic inflammation, which weakens the jaw's foundation. So bone is constantly remodeling, but that requires a healthy, stable environment. So when you're insulin resistant, your body is flooded with these inflammatory markers like TNF alpha or tumor necrosing factor alpha, interleukin 6 or IL-6, and C-reactive protein, otherwise known as CRP. These three inflammatory markers, these inflammatory mediators, do several things. They activate osteoclasts, which again break down the bone. They suppress collagen formation, which is the underlying structure for bone and teeth to be fabricated or made. And it also impairs angiogenesis in bone supporting tissue, which means the new blood vessels can't grow into the area to support the bone supporting tissue, as I mentioned. So there was a 2021 review in Frontiers in Endocrinology, which concluded that metabolic syndrome is a key risk factor for osteoporosis with strong effects on mandibular bone density, which is our lower jawbone. So if you place an implant in a patient with good hygiene but poor metabolic health, despite perfect implant placement and grafting, despite bone density drops and then the osteointegration or the fusing of the implant to the bone fails. So the surgical technique didn't fail. It was the metabolic environment which did. Now, the third thing that can happen, or the third thing we should focus on, is how a low carb, ketogenic, and carnivore diet can normalize bone hormones. So, how does food fix this? Well, low carbohydrate diets do three key things. So, the first thing they do is they lower insulin and restore anabolic signaling. So, low carbohydrate diets lower the insulin levels, of course, and the signaling is increased or improved. We get reduced inflammatory cytokines like those mediators that I spoke about a minute ago that break down bone. So if we reduce that, we reduce those inflammatory cytokines, we get less bone loss. And then it causes an increase in absorption of fat-soluble vitamins, a low carbohydrate diet, which is critical for bone metabolism. So there was a 2020 trial in nutrition and metabolism, which found that postmenopausal women on a ketogenic diet had increased markers of bone formation and reduced resorption or destruction of that bone compared to controls. And this was independent of calcium intake. So it did not matter. All of the participants in the study had stable calcium levels and intake levels. So think of your skeleton as a building under constant renovation. Low carbohydrate eating gives your body the right workers, tools, and blueprint to repair what's breaking. So we have to think about the jaw as the canary in the coal mine, not coal mined. The alveolar ridge, or the ridge that supports the teeth, that bone is some of the most metabolically active bone in the body. And that's why tooth loss often precedes osteoporosis, how jawbone density reflects insulin resistance, and periodontal disease or gum disease accelerates skeletal bone loss or bone loss throughout the rest of the body. And there was a 2012 study in Osteoporosis International, which found that decreased mandibular bone mass, so less lower jaw bone, strongly correlated with low femoral bone density in women, so the thigh bone in women. And this was even before they showed evidence of clinical osteoporosis. So here's the practical takeaway for all that I just previously mentioned. If your dentist sees bone loss in your mouth, your doctor should be checking your metabolic health. And the fifth thing, we need to talk about rebuilding bone from the inside out. So, bone health isn't about calcium supplementation or taking supplements, it's about metabolic signaling. So, what types of things can you do to rebuild the bone? One, you can cut out sugar and seed oils. Two, you could prioritize animal protein and collagen-rich cuts. Three, you can get vitamin D, vitamin K2, magnesium from food, not just pills. You can walk, lift, and use your skeleton. And of course, you can track insulin, not just glucose. So, in the Journal of Bone and Mineral Research, researchers found that insulin sensitivity, not just glucose control, was a strong predictor of bone density and fracture risk in both men and women. This was a study by Dentistry et al. In 2019. So you don't reverse bone loss with dairy alone. You do it by fixing the root signal. So this has been episode 73 of the Obesity Project, how low carbohydrate diets reverse bone loss starting in your jaw. The next time you see gum recession, a failed implant, or jawbone shrinkage, don't just reach for the scaler, reach for the root cause, because food isn't just fuel, it's your architecture. It's what makes us and makes our body tissues from the things that we eat. So remember, don't forget, we're cutting through the myths, getting to the root here on the Obesity Project. So thank you so much for watching. I appreciate you. I hope you learned a little something, both about dentistry and metabolic health. And stay tuned for more great videos. Make sure to hit that subscribe button, that bell notification, so that you get notified when I come out with new videos. And like, share, and comment as always. Again, I appreciate you. I appreciate your time, and I will see you in the next video.